I want to talk about Rasakshaya and how to assess that and how to treat that in various conditions. One, I have seen like two cases. One is that straight Rasakshaya symptoms like Rauchya or all the typical Rasakshaya symptoms, lean and all of that. For example, I have a lean PCOD patient where every kind of like regular treatment kind of failed. I started giving Rasa Tarpana. It kind of worked, but it didn't work for her at all. She's still having amenorrhea since 3 months. I've literally tried like every line of treatment, but it hasn't worked. I still feel that I'll explain her symptoms exactly. So she has Agni Mandya. She feels like her appetite is very less. She doesn't feel hungry often, or she feels full with less amount of food. And whenever she's stressed, she gets this amenorrhea basically. Her scan is also clear, to be honest. Like they've told like only very mild PCOD. It's not even there but like that. And she gets like 3 to 4 months she gets her cycle, then again it's like 3 months of amenorrhea again. And with a lot of vulva pain and a lot of acne on the face, like abscess here and there and all of that. But if I try to increase the Agni a little bit, then again all these acne and everything like flares up a lot. But I give like Pitta-Hara kind of line of treatment, then she doesn't get her cycle. I'm like little clueless what to do here.
The problem with such conditions is that in these cases, see, Artava.
And now she's changed her food. She's like literally eating whatever patya I've told her. She's sleeping on time. She's waking up on time. She's doing everything possible. So I'm a little clueless about this case.
See, in such cases, what problem means while formulating this samprapti, we always get confused with such cases. The thing is like every Vaidya thinks first is that Ushna or Tikshna Dravya, which will go in there and just break the the blockage, and there'll be Artava Pravritti, Raja Pravritti.
And Anulomana kind of. Yeah. I tried Anulomana also with her. I've tried every possible thing with her. It's not happening.
So that is the first thing that comes in mind, which may be correct until and unless we have confirmed that it is because of some obstruction, and Artava is correct. The second thing is like Agni Vriddhi. So we'll increase the Agni, and that will cause the Raja Pravritti. The problem with such cases is that in such cases there is Rasa Vikruti or Rasa Kshaya. See, Artava.
Yes, exactly. That's what I guess. That's what I guessed. And I don't know if I did the right treatment. I gave Arogyavardhini and Draksharishta, but it didn't work for her.
Yeah. So in such conditions, see, the Artava or Raja is Upadhatu of Rasa. So if it is not getting produced, it is not getting, there are no periods, means there is less of Artava or less of Raja. Why could there be less Raja? Because Rasa is not able to provide enough nutrition to Garbhashaya. And that is why there are no periods. So increasing Agni or giving something for Bhedana is not the treatment for such condition. So for 3 months, there have not been periods. How could you expect that there was obstruction for 3 months and there was no periods? What would happen to Garbhashaya, which has got accumulation of Artava of 3 months? So it's not like, it's not acceptable. So in such conditions, what actually happens is that Artava is not formed. So if you are considering it in modern words, the endometrium isn't formed enough.
Right.
So if it is,
because her endometrium thickness, even after 3 months of amenorrhea, is just 7 mm.
Yeah, if the thickness is achieved, there will be periods.
Correct.
So we can
Correct.
say that there is no enough of thickness of endometrium, because of which there are no periods. So Rasakshaya is Nidana in such conditions.
Correct.
Hmm.
What should be the line of the treatment for this then? Maybe my selection of drugs is wrong.
No, it's not wrong as such. Maybe it was correct for your patient.
What would you do like this? I have tried everything possible. I have tried. I even tried proper Marshanasya also. It resulted in a lot of kapha which like came out to her. But then again, it increased her acne a lot after the treatment. So
you have to give Prinana.
I'm pretty confused.
Prinana and Brahmana. Any type of Prinana or Brahmana works in such conditions.
She is not able to digest the Brahmana Dravya what I give her.
Yeah, that's why Prinana.
Okay.
See, Brahmana
Can you give
Dravya
me
are
like example for it? Laja or something probably?
yes, Laja, Peya, Manda, all type of Manda. You can give Mandas, different type of Manda you can give. You can also give Yusha.
Okay.
Kshira. You can give Kshira Paka. Brahmana Dravya, Kshira Paka. So you will achieve both.
Okay.
Prinana and Brahmana.
Okay. Kshira Paka. Will Grita administration here work or not work?
May not work when
Like
there is no Agni.
May not work, no? That's what it
Yes.
didn't work for her. I gave Mahatiktaka, it didn't work. I gave in very small dose, but didn't give. I gave her 3 ml, it didn't work for her.
So, Ghrita doesn't work most of the times unless Agni is correct.